The importance of mental health awareness. According to the National Alliance on Mental Illness, 1 in 5 people in the United States lives with a serious mental health condition. But stigma and a lack of understanding can make it harder for people to get the support they need. That's why every October, people come together for Mental Illness Awareness Week and World Mental Health Day in order to raise awareness of mental health topics. But what exactly is mental health awareness, and why does it matter? I'm David Yadush, LPCC, and I'm here with BetterHelp to help answer these questions. In this video, we'll be talking about mental health awareness and its importance. We'll also explore some of the most common mental illnesses, the stigma surrounding mental illness, and some of the ways that you can look after your own mental health any month of the year. Let's dive in. What is mental health awareness and why does it matter? You might already know someone with a mental illness, or maybe you're even experiencing one yourself. According to the National Institute of Mental health challenges affect around 23% of adults and around 50% of adolescents. Mental health conditions can affect people of any age, gender, race, or sexuality. They come in many different forms, and their symptoms might not always be easy to spot. When you're struggling with your mental health, the right treatment can be life-changing. But mental health stigma, a lack of mental health education, and the cost of treatment can all discourage people from seeking support. That's why so many events and organizations exist to build mental health awareness. Knowing that you're not alone and that help is available can make you feel more empowered to talk about your experiences and seek treatment. It can also make it easier to recognize when you're struggling with your mental health and take steps to improve your quality of life. Why is it important to understand common mental illnesses? Building mental health awareness often starts with education. The more you know about different mental illnesses, the easier it can be to recognize their symptoms, in yourself and in others. With that in mind, let's take a look at some common mental health conditions to be aware of. While these conditions can be challenging, they are often manageable with the right treatment. Anxiety disorders. Anxiety disorders are one of the most common mental health challenges. These disorders cause excessive levels of anxiety, a sense of unease or worry about future events. Common symptoms of anxiety include trouble concentrating, constant worrying about the future events, racing thoughts, and physical symptoms like trembling or a rapid heartbeat. Some people with anxiety disorders may even experience panic attacks, episodes of overwhelming fear that are so intense they can feel like a medical emergency. Generalized anxiety disorder, social anxiety disorder, phobias, and obsessive compulsive disorder are all common examples of anxiety disorders. Mood disorders. Mood disorders are mental illnesses that affect how you feel. You may have already heard of depression and bipolar disorder, two of the most common mood disorders. People with depression may struggle with persistent sadness, low energy, a lack of motivation, and trouble concentrating. Meanwhile, people with bipolar disorder tend to experience intense mood swings, alternating between periods of depression and periods of energy and euphoria. Mood disorders can be mild to severe and can significantly affect quality of life. Personality disorders. Personality disorders are long-term patterns of thoughts and behaviors that go against what's culturally and socially accepted. These symptoms can lead to challenges in relationships, problems at work or school, or even legal troubles. Some common examples of personality disorders include borderline personality disorder, antisocial personality disorder, and narcissistic personality disorder. Psychotic disorders. Psychotic disorders, like schizophrenia, are mental illnesses that affect how you perceive reality. People with psychotic disorders may hallucinate sounds or images that aren't real. They may also develop delusions or rigid beliefs with no basis in reality. These symptoms can be disruptive in daily life. Trauma-related disorders. Trauma-related disorders are mental illnesses that can develop after a traumatic experience. Survivors of war, abuse, natural disasters, or other forms of trauma may relive these experiences through nightmares or flashbacks. They may also experience feelings of fear, panic attacks, or other physical and mental symptoms. Post-traumatic stress disorder, or PTSD, is one of the most well-known trauma-related disorders. Why is it important to reduce mental health stigma? Learning about mental illnesses like the ones we've discussed can be useful, but mental health awareness also requires us to understand and work to reduce mental health stigma. We'll discuss this in more detail in a moment, but first, don't forget to like this video and subscribe to the BetterHelp YouTube channel for more mental health resources. So, what is mental health stigma? Stigmas are negative sets of beliefs about a person or a group of people, often based on stereotypes and generalizations. Myths and misinformation about different mental illnesses contribute to mental health stigma. For example, men and boys are often discouraged from talking about mental health challenges due to myths like, real men don't cry. Similarly, people with addiction often face assumptions that their behavior is a choice, or that the only reason they're struggling with substance use is a lack of discipline. It doesn't stop there. People with depression, anxiety, bipolar disorder, and trauma are often told to just suck it up, or you don't need medication or therapy, you can just change your attitude. Even the language we use can contribute to mental health stigma. Saying things like, the weather is so bipolar today, or I'm so OCD about keeping my house clean, can make these serious conditions feel like a joke. This can make people feel ashamed to seek help for their symptoms, or to talk to others about what they're going through. Raising mental health awareness means being careful with the language you use and speaking out against those harmful assumptions. By challenging mental health stigma, you can help improve society's understanding of mental illness. How can I be better about caring for my own mental health? It can be easy to forget, but mental health awareness also includes awareness of your own mental health. Supporting yourself can make it easier to support others. That's why it can be important to make sure you're living a healthy life and practicing behaviors that contribute to your well-being. Remember, self-care doesn't have to be time-consuming. Just a few minutes a day can help support your mental health, physical health, and quality of life. If you don't already, consider taking a few minutes a day to do things like meditate, write in a journal, or work on a hobby or personal project. Getting regular exercise, going out in nature, and spending time with loved ones can also be helpful. If you're experiencing mental health symptoms, or you just want someone to talk to about what's going on in your life, remember that it's okay to seek help. Talking to a therapist or a counselor can help support your mental health and make it easier to manage whatever challenges you might be facing. In conclusion, mental illnesses can affect anyone. By educating ourselves and others, we can help reduce stigma, recognize the symptoms, and make it easier for people who are struggling to get the care they need. Want to learn more? See the link in the description for 7 things you should know about mental health. And if you like this video, don't forget to give it a thumbs up, subscribe, and turn on notifications so you don't miss out on future content. Take care.